Why do dementia patients wander neurologically? Imagine a person trying to find their way in a familiar neighborhood, but suddenly everything feels unfamiliar and confusing. That's similar to what happens in the brains of people with dementia when they wander. Dementia affects parts of the brain that help us remember where we are, recognize landmarks, and make decisions about moving around safely. When these areas are damaged, it becomes hard for the person to judge distances, identify familiar places, or understand their environment. This often leads to wandering behavior. The brain regions most involved include the parts responsible for spatial memory and visual understanding, like the front and side areas of the brain. Damage here makes it difficult to tell where they are or how to get back home. Studies using brain scans show that in people who wander, these areas have less activity and blood flow. Also, dementia can disrupt the body's internal clock, leading to sleep problems and increased confusion during late afternoon or evening, a phenomenon called sundowning. This can make wandering more likely during those times. Wandering isn't just about brain damage. It can also be a way for the person to meet needs they can't express. For example, they might wander because they are hungry, thirsty, in pain, or bored. Anxiety or fear can also drive wandering, especially if they feel lost or scared in unfamiliar environments. Sometimes, they are searching for a loved one or a familiar place from their past. Changes in routine, new surroundings, or even medication changes can make confusion worse and increase the chances of wandering. From a caregiving point of view, it's important to understand that wandering isn't intentional. It's a symptom of the brain's decline and unmet needs. In the middle to late stages of dementia, this behavior becomes more common. Caregivers can help by creating safe spaces, maintaining consistent routines, and addressing physical needs quickly. Using tools like alarms or GPS trackers can also help keep loved ones safe. Recognizing wandering as a neurological response rather than misbehavior helps us respond with compassion and patience. Overall, wandering happens because the brain's ability to orient itself, remember, and make decisions is impaired, combined with the person's emotional and physical needs that they cannot communicate clearly. This complex mix of brain changes and unmet needs explains why wandering is a common part of dementia. Remember, always consult healthcare professionals for personalized advice and support.